Incontinence. Introduction. The sphincters automatically tighten as the bladder fills up. Select true or false. Correct. As the bladder fills up, the sphincter muscles automatically clamp down around the urethra to keep it closed and prevent urine from leaking. People can control their sphincters by relaxing them or tightening them willingly. Select true or false. Correct. To urinate, a person purposely relaxes the sphincters and contracts the bladder muscles, causing urine to pass through the urethra. Linda loses control of her urinary bladder when she sneezes. Which type of incontinence does she have? Choose one of the following options. 1. Functional incontinence. 2. Overflow incontinence. 3. Stress incontinence. 4. Urge incontinence. Correct. Overflow incontinence can cause serious diseases if not treated. Select true or false. Correct. In cases of overflow incontinence, the urine that stays in the bladder can cause pressure against the kidney. This could lead to kidney failure and possibly dialysis. Aging causes incontinence. Select true or false. Correct. Aging does not cause incontinence. However, it is more common in older people. At least 1 in 10 people aged 65 or older has incontinence. Both prostate cancer and prostate enlargement can cause incontinence. Select true or false. Correct. That is why the doctor may check the size of the prostate by doing a rectal examination for men. Surgery is one of the first options considered for treating incontinence. Select true or false. Correct. When possible, the doctor recommends the simplest and safest treatments first. Thank you for using Explain.